All right, wonderful. Good afternoon, everyone. Welcome to our first policymaker engagement training. We're going to talk about community organizing to advance health equity policy today. And we are so honored to be joined by Britta Babel from the American Cancer Society. I'll be doing her intro in just a minute, but I want to make sure that you know you're in the right place. And we're so excited and happy to have you all here today. So just a few housekeeping things, please go ahead and mute your microphone when you're not talking. We do want to ask you to ask questions throughout, drop them in the chat. When it's time to engage, take yourself off mute, but let's not hear the background noise in the meantime. It's totally up to you whether you want your camera on or off. We love to see your faces and it's more engaging, but we totally understand if you cannot have it on right now. If you feel comfortable, go ahead and rename yourself. You can do that by clicking, there's 3 little dots by your picture, and you can click that and click rename, and you can put your pronouns if you want. And again, please go ahead and put things in the chat. So we just want to take a minute and talk about the ancestral land statement, which is how we begin every meeting and training. So we ask that you take a moment to honor and acknowledge that we are on the homelands of the Dakota and Anishinaabe and people. Indigenous people have had long-standing history and connection to the land since time immemorial, and we are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and U.S. governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people and ancestors and descendants, as well as the land itself. So with that, we are going to go turn it over to Britta. Britta Babel is from the American Cancer Society. She cares deeply about people harnessing the power of their stories and ensuring lawmakers hear from their constituents about how policies impact real lives. Britta's background is in social work and in public health and dreams to make communities healthier for everyone. When Britta isn't working, she's spending time with her dog, crafting or daydreaming about what to make for dinner. She resides in South Minneapolis, and we will go ahead and turn it over to her to get started.
Awesome. Thanks so much, Chris. And thank you everybody for having me as part of today's content. I'm really excited to be here. Chris already covered my bio, which we'll talk a little bit more about me in a minute, but our 3 goals for today is how to talk about effective recruitment and capacity building, learn how to integrate some strategy into effectively bringing more voices into your work, and use real policy as an example to demonstrate policies in action. So before we get started too much, I'm going to talk a little bit about me and what brings me here. So like Chris said, I'm Britta. There's my bio again. In my work, I work as the Grassroots Manager for the American Cancer Society Cancer Action Network. We're the advocacy affiliate of the American Cancer Society, which I'm sure a lot of you are familiar with. We work to advocate for evidence-based public policies to reduce the cancer burden for everyone. And obviously, we know that although cancer impacts all of us, it does not impact all of us equally. And so for us at ACS CAN, health equity is definitely woven into all of the work that we do and the policies that we work on. To make sure that it is woven in everything that we do, from the policies we work on to how we recruit our volunteers to the training that we give our volunteers. And in my role as Grassroots Manager, I do a lot of different things, to say the least. I'm sure a lot of you are also nonprofit folks who have your hands in multiple buckets. But a huge portion of the work that I do is around our volunteer base and recruiting other people into our mission to bring them forward, to raise their voices in support of the work that we get to do to fight cancer. And so for me, that looks like expanding the number of members in our volunteer community who are going to take action. And we know that the more people that we include in our fight against cancer, the stronger our mission is, the better we represent what cancer looks like across the state of Minnesota, and the more work that we're going to get done. So instead of my fancy headshot here, you have a picture of me and my late mom. And I bring this because I think when we're always trying to bring more people into our mission and more people into our work, it's a really important reminder to keep in mind what brings us all into this kind of work. So for me, my mom passed away from cancer when I was 9 years old, almost 20 years ago. And so she's the main reason that I got involved in the work that I get to do today. And I say this because when I think we're recruiting new volunteers or building relationships with new partners, it's I'm always thinking about what brings me to work every single day. Obviously, we get a pay, a lot of us probably get a paycheck, which is obviously good and helpful. But for me, especially when I'm talking to volunteers who are going to be committing their time and energy to support the mission I get to work for, it means so much to them to know that I have that vested heart stake in this work just as much as they do. So many of my volunteers come in with these deep personal connections to cancer, whether they're a cancer survivor themselves, they've lost a loved one, they've been a caregiver. It makes such a huge difference for them to know that the staff partner that they get to work with also has that deep vested connection into the work. And we'll talk a little bit more here later on in this presentation about how to bring more people into your fold. And I think it's so important to keep in mind what brings us to this work and why we care about it, because it makes some of the harder parts of our jobs, I think, a lot easier. But it always helps to bring that community and make us stronger when we're thinking about the reason that we get involved. Obviously, I work for the American Cancer Society, so a lot of my things are going to be cancer-y referenced. Oh, you can go ahead, Chris. A lot of my things are going to be kind of under the guise of cancer because that's my lane I work in. But a lot of this, I hope, can be applied to whatever policies that you work on or whatever area of public health that you work on. So I believe Chris or Mary set up a mentee for this. So just to get an idea of who's in the room with us and what policies you all might be working on is just what is a policy priority that you might be working on professionally in the work that you do, or what is like a public health change that you'd like to see in Minnesota? This, I think, will just help you conceptualize a bit of this training and help be able to help apply it into your own work. So I don't know how Mentee works. So Chris, I don't know if it was set up.
Yeah,
okay.
Just actually have everybody drop in the chat instead of Mentee right now, if that'd be all right.
That's great.
So yeah, so if you could go ahead and drop in the chat, what priorities or health policy changes are you working on and that you'd like to see in Minnesota? Love that. Universal health care, commercial tobacco control. Would you like me to read them, Britta, or do you want me?
Yeah, that would be great. Let's read them for a minute.
Okay. Okay, so making healthcare affordable, data equity issues, speaking our language here, healthcare more affordable, birth outcomes healthy for every family, community health worker reimbursement, funding and infrastructure, and some more commercial tobacco prevention, improved systems and reimbursement for community health workers, becoming trauma informed, a city ordinance that would end discrimination on income for housing so that Section 8 vouchers could be used at any property. Protections and health equity issues surrounding migrant workers. Let me know when you need to stop so we can go on. There's
that's
so many
great.
great ones.
I love it. This is good. Fun. I love the ideas and the energy. And I think keeping those ideas and those policies and those priorities in your mind will help shape the rest of this training for you and help kind of apply and figure out things for you. I love it. And so we're going to talk today about a variety of things that all have to do with community organizing and making those really bright, beautiful futures that we all are daydreaming of with the policies that we're working on. So before we get too much further, we're going to talk about recruitment and capacity building, which is such an essential tenet of organizing work to expand our capacity and make these things actually happen. And so when we say recruitment and capacity building, we're talking about bringing people into the work that we are doing. We're talking about bringing them into the mission or the issue or the campaign. I hope I'm framing a lot of this almost loosey-goosey enough that you're able to apply it to whether you do some sort of policy work or you're super mission focused, that these are still things that you're going to be able to take bits and pieces of and apply to the work that you do get to do on a daily basis. And so the people or the organizations that you're building these relationships with and bringing them into the fold, not only are they bringing themselves to this work, but they're also bringing like their capacity that they might have as an individual to do tasks, get stuff done, but they're bringing their skills and their knowledge and their talents and their other resources and relationships to help move it forward and make it kind of all actually possible and a reality. And so when we think about capacity building and recruitment, we know why it matters. So you can go ahead. Perfect. So when it comes to public health, and the importance of recruiting and expanding our capacity in all the ways. It matters for more reasons than just on the screen here, but these were just the 6 that I wanted to really touch on to make us think about the importance of expanding and bringing more people into the work, especially when we're working towards those really big, lofty health equity policy goals. So we know that historically public health has some really big competition at the state capitol. So for me, I work strictly in advocacy and policy change. And so for me, I'm always thinking about the folks who we are up against at the Capitol who might be opposed to some of our work. And so we know that there's never going to be a public health organization that's going to have the same resources as big tobacco. If that ever happens, that would be incredible to have such a well-resourced public health powerhouse. But we know a lot of our organizations, we're never going to have the money for huge lobbyist teams in their fancy suits. We're not going to have the ability to endorse candidates or donate to PACs or donate to politicians to really be able to champion our things. We really, really rely on those volunteer voices and those voices of the people who are really talking about the work. And so for me, as a grassroots manager managing our volunteer base, it is so important to me that I can have one thing that big groups like Big Tobacco don't have. I can have volunteer voices, and I can have voices that are represented across the entire state of Minnesota to help advocate and champion our work. For me, again, under that cancer guise, it is so important to me that my volunteer base and the folks that I bring with me to the Capitol and the stories that I'm uplifting are representing that whole cancer continuum. So there's obviously, all of our stories are so different. Our lived experience, whether you work in tobacco control or you work in housing, whatever that may be, like we know that there's not like one story in one category that every single person falls into. And so for me, it's so essential to make sure that I have a variety of lived experiences on this team of people, because together, when we meld those stories, we're going to be so much stronger when we're able to cover so much track. And yes, Antonia, I love that. You are reading my mind with this next one, being representative of the communities that we're working in. So for me, I know that, like I said at the very beginning, cancer impacts all of us, but it does not impact us all the same exact way. And I'm obviously a white woman talking about this. And we'll talk a lot more about like kind of handing the mic over to other folks in a couple more slides. But it's so important to me that to make sure that when I'm looking at my volunteer base and I'm looking at the advocates and I'm looking at the people who I'm getting in front of lawmakers, that they are representative of the communities that they live in and that they are representative of all of the cancer stories that can be taking place across the entire state of Minnesota, for me, at least in the work that I do. And so when I think a lot about, if I'm working on something around prostate cancer and the fact that African-American men are much more likely to be diagnosed with a later stage prostate cancer, like, am I really the right voice for that sort of work? I can be if I need to be, but that's so much more compelling when we have somebody who has so much more of that lived experience as a person of color, who has family experience in prostate cancer, what have you. And for me in the work that I do, it's so important for stories to help illustrate the issues that we're working on. We can always, I know we all work in public health or connected to public health in one way or another. We all have the facts and numbers that we can always be referencing. We know that, cancer has decreased like 20%. Cancer rates have decreased like 20% since 1991 or something like that. That's really compelling and meaningful, but that's not going to stick in somebody's head the same way as like a personal story that can illustrate an issue and really show that direct impact, especially when I bring people to the state capitol. We can go in and we can talk about the importance of biomarker testing and how it does X, Y, and Z. But it's so much more compelling to have that volunteer who's able to sit in front of you, that real life experience, and is able to share how biomarker testing was able to extend their life. And 2 years later, they are still a survivor of stage 4 lung cancer because of a targeted medication that they were able to get on. Those are things that I can sure be like the messenger between of, but I'm never going to be as compelling as somebody who's able to really share that actual lived experience, be able to say be able to fully embody it and illustrate it in a way that I could never. when it comes to passing policy in particular, lawmakers love to listen to constituents. So if you are really trying to advocate for some sort of huge policy that would be from the top down at the state level or even the federal level, if you really need a lawmaker to get on your side, you're going to want to have somebody who lives in their district be the one getting to do the talking to them. Lawmakers listen to a lot of different people all of the time. And, you know, they listen to the lobbyists, they listen to the experts, but the things that lawmakers really care about the most are who can donate money to their campaigns and who can vote for them in and out of the position that they hold. And so, like I said, public health, we obviously don't have the money to provide much of a threat there, but what we are really able to do is we are able to share bring constituents in the room with their lawmakers and be able to put it all out on the table. And lawmakers are really going to listen to those constituents, especially when a constituent's able to share that story that we talked about. And truly, when I know so many of us are, we work for really small organizations. We don't have a ton of people staff-wise, or we are at capacity in our own professional work that we're doing. Many hands makes little work. I'm going to be talking about some of the coalition work that ACS CAN's really thankful to be a part of, that I know actually some of our partners are on this call, which is fun. When we're all able to join together and be a force and work in coalition, we're going to get so much more done and work so much quicker, and we're going to have so many more resources when we're able to work together. And so next we're going to talk about like a policy priority that I think really shows and can help illustrate this issue, and we'll talk a little bit more coming back to it. So an example in action, one of ACS CAN's policy priorities is ending the sale of all flavored commercial tobacco products, including flavors like menthol. So we work in coalition with this. I know I have some coalition partners on this call, so if they have anything they add, they should make sure to come up mute and add anything in here. But ACS CAN, we're a proud member of and leader of the Minnesotans for a Smoke-Free Generation Coalition. Smoke-Free Gen is the largest coalition of groups across the state of Minnesota. There's public health groups similar to ACS CAN, all the way to hospital systems, to health plans, to school districts, all across the board. And we do a ton of different work around tobacco control, from removing barriers to cessation services for more Minnesotans, to protecting and increasing prevention funding, and a lot more. And one of the main issues that we're really working on is ending the sale of all commercial flavored tobacco products, including flavors like menthol and products all the way from combustible cigarettes to e-cigarettes to hookah to chewing. When I say commercial tobacco products, I mean the whole thing. And so we know that especially when it comes to this issue, it is a massive health equity issue. Yes, big tobacco impacts everybody from all walks of life, but especially when we're thinking and talking about menthol in particular, we know that big tobacco has really targeted the African-American community with menthol products for decades upon decades, and we see the harm that has done to their communities. And so when we are thinking about this campaign, Smoke-Free Gen is thinking about those dynamics of a policy like this. And I was not a part of when we figured out how we were going to approach this, but I'm really proud of the work that we're doing. So what Smoke-Free Gen did is we created kind of an alongside group of people who are working on this called the Menthol Coalition. And Chris, you can go to the next slide. So the Menthol Coalition is made up of a variety of different organizations that are led by people of color, leaders of churches, especially in North Minneapolis, members of the African-American community, mostly based here in the metro area. And this group is really working to kind of be the face of this issue for us at the state capitol. And so these are the folks who are obviously going to be able to share that real life impact. They're representative of a community that's done the most harm, or that has experienced the most harm from the product that we're really trying to get a handle on. And so these are the voices that are being lifted up. They're the voices of experience and expertise, and they're the people with the lived experience that we're really trying to lift up. So just a fun little photo here. Last month in the city of Minneapolis, it was declared No Menthol Sunday on May 21st. No Menthol Sunday is a day of celebration that comes from the Center of Black Health and Equity, or Health Equity. I'm butchering that, and I'd be happy to correct myself. But it's a day of where a lot of churches do a lot of work around educating their members on tobacco and menthol and those sorts of things. And so I was really excited. You can see these are a lot of members of the Menthol Coalition there. They represent the face of, you know, who we're really trying to solve some of the harm here for and who we're working with. Yeah, so you can go ahead there, Chris, to the next one. And so thinking about this in action. So think back to the picture. We have the voices of those who are most impacted being lifted up. Those are the people who are going to be testifying at the state capitol. Those are the people who are doing a lot of the work on the front side of things. And a lot of organizations similar to ACS Can and people who look like me, we're taking the back seat and doing a lot of the work behind the scenes so that the people who are going to be most impacted are really going to be able to show the face, share their stories, lift their voices. I think a lot of times when we think about health equity, you know, it's obviously great for white folks and more privileged people to be able to talk about the importance of health equity, talk about the value and importance of being an ally and all of those good things. But again, like, I'm not the right messenger to be going in front of a committee hearing and talking about ending the sale of flavored tobacco products, especially if all of my testimony is going to be referencing harm that big tobacco's done to the queer community or to Black people. Like, I'm not the most compelling person to be able to talk about that. And so if we really want to move health equity forward, making sure that people who are the ones doing the most talking are the ones who are really sharing that lived experience and are really the right mouthpieces and messengers for it. There's the quote that I think always comes up with a lot of policy change and campaign work is nothing about us without us. And I think a lot of times, obviously, public health has a tendency to skew pretty white, pretty female dominated space. And so, at least from my experience. And so we really want to make sure that, like, we're not making policy priorities on behalf of communities without getting their vested interest, their say. We're not going to make a policy recommendation and be like, oh, here's the solution, we're going to make this happen. We're going to make sure that we're working with the community that's actually being impacted and getting their say in the work and building up their voices. And we're going to share the resources that we do have. So groups like ACS Can, we're pretty well resourced. You know, we're a very small and mighty organization, but I have tools and skills and flexibility that not everybody's going to have. So what can groups like ACS Can do to do a lot of the resource sharing? How can we use the expertise that we have inside of our group to be able to help other organizations who other capacity doesn't have the same exact way? Another example of that is a couple of years ago, ACS Can, we were really lucky to be able to work with the American Indian Cancer Foundation on one of their bills around their Screen Over Circle program in 2020. And so for us, it was an issue that ACAF brought to me and my colleague Emily, saying, this is an issue that we're working on. Could you help us with this? Like, could you join us in this fight? And so we were able to take that bill on as a policy priority. You know, we're an advocacy organization. Our one lane is advocacy, where ACAF does so many different services across the board. They don't have that same flexibility as a C4 like ACS Can is, so we can lobby unlimitedly. But we were able to work with ACAF and work with the staff at ACAF to get this bill passed. We were able to use our skill set as an advocacy organization to help get them lawmaker meetings and bring them with us to talk to lawmakers about the issue. We were able to use the skills that we have to write really strong testimony and create all the collateral materials that they have. And then we were able to say, like, hey, here's the drafts. What edits do you want to make to this? Like, you're the community, you are the program that serves this community. This is your program. Like, what did we hit the mark on? What did we miss? How can we get better? And thankfully, we were able to work with them so well. It passed in one session, which is absolutely incredible. But we were able to use the resources that we do have to be able to really help lift another organization up, lift the voices of those who are most impacted. and be able to improve public health at the same time. And again, lawmakers are such an important part of this. ACS Can, we have been, lawmakers will kind of call you out on stuff, I will say. And I think they only will do it when they know something good can come from it. My colleague was asked by Senator Bobby Joe Champion a couple of years ago when she was in a meeting. It was after ACS had kind of gone through some structural things, and there was a disinvestment in some parts of the state of Minnesota. And he just asked her, point blank, like, what are you guys doing for my community these days? Like, what's happening? Because very candidly, ACS Can, we're a very white organization. My volunteer base skews white. My volunteer base skews to older women. So like, it made us pause and think about like, okay, like what story are we telling for cancer patients across the state of Minnesota? Who are we bringing into our work? Who are we lifting up? But I think it's a really great sign of a lawmaker having some trust in an organization to be able to kind of like lovingly call us out when it comes to that. And so we know how important recruiting and capacity building is. I think I'm preaching to the choir when it comes to the importance of bringing more people into our work and talking about. We all know, especially if you have any footprints in volunteer management or volunteer recruitment at your organization, you know how important it is. But a lot of times I feel like I don't have the right tools to be able to actually execute it and do the work. And so these are kind of like my 5 rules I really try to follow when I'm either working to recruit a volunteer or working on building a relationship with a new partner organization that we might not have a relationship with, that I hope can help resonate for you. So pushing through the outreach fear. I'm a millennial. A lot of my friends are afraid of talking on the phone or answering phone calls from numbers they don't have saved. I'm not like that. I'm probably a little bit too open-minded to answering whoever's calling me. But pushing through the kind of like the outreach fear of having to make the cold calls, send the emails that might not go answered. If you're at a health fair, sometimes it can be a little nerve-wracking to say hi to all the people walking by, knowing they're not going to come talk to you. Or even if you're attending one, you might feel a little introverted that day and not want to go and talk to all of the tables and hear what they have to say. But I encourage you all to kind of push through that outreach fear and to help build those bridges, because we're never going to really get to that full picture of those big, beautiful, lofty daydream policy priorities that I hope aren't daydreams. They have meat to them. They can be a reality, but we're never going to get those goals possible if we're not willing to kind of like put some of our own stake into it and kind of push through, even though if we might be feeling a little nervous or anxious about it. On that same note, you're going to hear no when it comes to trying to recruit and build your team. If you're working with if you're trying to recruit like a literal volunteer, they might not have the time, they might not have the ability to join your fight, your work, your issue, your campaign. An organization might not have the staff or capacity time to be able to join you. And so you might hear no. And I think that can be really make people feel uncomfortable, because we're human. We like getting like the yes. We like getting the automatic comfort of something like it makes us feel so much better, when we feel like we're going to get the good news and not have to kind of deal with the bad. But it's so much better to hear no than to like get ghosted or, never get an email back or a phone call back. But be prepared for that. You can have the most righteous fight and the most absolutely important issue. And again, it could be something that's so important to you. But it might not either fall in another organization's policy, like priority of the work that they do. For example, it could be something like flavored tobacco, where we know it has such a huge health equity component. But if you're talking to a group that's really focused on racial justice, maybe they're too focused on like police brutality, where they could be like, yeah, I totally hear you on it, and that's really important. But like, that's not our lane. That's not where our work is right now. And I think it's important to kind of respect and know and understand their no when you get it. There's such an intense value of showing up and keeping to show up. I think sometimes maybe you try thing one time and you don't get any hot bites, you don't get anybody who leaves the event and is like, oh my gosh, yes, I'm bought in 115,000%. You might not get that. And it might take a couple of years or a couple of outreach or staff turnover or something to be able to kind of get the information and kind of the answer that you're looking for. Sometimes you might get a no, sometimes you might get a maybe, and sometimes you might get a yes. But no matter kind of like what answer you're getting, it's so important to kind of work to continue to build the relationship. So maybe you get a no, but you're like, can I reach out to you in 6 months and we'll check in again? Or maybe you get a maybe, I don't have time right now, holler at me. Or maybe you get a hesitant maybe and you're like, well, what are the work that you're working on? How can I be helping you? What's something you're doing? Do we have an unexpected overlay on another issue that I wasn't expecting that can help us kind of build for what my initial ask was? And making sure that these relationships that you're building aren't one-way streets or transactional. We really want to make sure that we're valuing the relationships that we're building, whether they're on a one-on-one with a volunteer or organization to organization, making sure that it's not just a strictly one-way street and that it's not always you asking, but also turning it to being like, what can I do for you now? Like you came through on this, what can I come through for you? And then following through, did you say you're going to do something? Make sure you do it. A value to that, especially to continue to build the relationship, knowing that you're somebody that can be counted on, that you're going to follow through on something that you said you're going to do. Making sure that you do it has such an intense value, especially for me in the work that I do around volunteer management. If one of my volunteers asks me for something and maybe I don't have the time to get to it on Monday, the day they email it to me, they're not going to trust me if I drop the ball and not get it. And they might not be somebody who feels valued by my organization or feels like a valued part of my volunteer team. And for an organization like ACS CAN, our power strictly lays in our grassroots and the advocates and volunteers that we bring with us to the Capitol. And so it's so important for me that I'm following through for those people because they are so deeply essential to my mission, that I need to make sure that I'm doing what they need me to do and what they ask for me to do, especially when it's in the guise of things that I do work on. So we're going to talk a little bit about making the pitch. So we know the importance of recruitment and capacity building. We have a little bit of some ideas of how to do it. But I think a lot of times we all struggle as to like, how do you actually like make the ask? How do you like extend the invite? How do you like bring it all in? And so I always think of it as like a little elevator speech. Like think of having like 90 seconds with somebody. Like how are you going to make the most of the 90 seconds and like make the invite? So we're going to do a little bit of an activity around creating your elevator speech is what I like to call it. And Chris, you can go ahead to the next one, where we think a little bit about, okay, we have our issue. There was somebody who said universal healthcare. Like, okay, I want to create a universal healthcare program here in Minnesota. And I want to recruit 5 people who also care about this. And they might not be 5 people I know. So I kind of got to lay it all out on the table for them. And like, I like challenging myself with like the hypothetical situation of maybe I'm tabling at a health fair and I'm going to only, get those couple seconds to like lasso somebody in to come talk to me. Like, how am I going to do that? And how am I going to frame it? And how am I going to get my point across and introduce myself and also leave them wanting to learn more type thing. And I think there's a couple different ways to do it, but one way that I like to think about it, and when I talk to my volunteers about recruiting, is taking the skills that a lot of my folks have from lawmaker meetings. A lot of you, if you've ever been to a Day at the Capitol event or something like that, you've probably seen the hook, line, and sinker method when it comes to lawmaker meetings. I like taking the same exact concept and switching it up a little bit and using it to create kind of like my little elevator speech and my elevator pitch to bring people into the work that I do. And so the hook, line, and sinker method, it is pretty self-explanatory once you kind of actually can look through it a little bit. But so you use the hook to introduce yourself. In this scenario, let's pretend we're at that health fair, we're getting people in. I would say, I'm Britta, I work for the American Cancer Society. I live in Minneapolis, but my work is statewide. I would share for the line, this is where you would talk about your personal connection to the issue, your experience, the opinion, the issue, the campaign, and really be able to connect to why you think it's really, really important. So for me, I would give an example of, in my role, I'm a grassroots manager. It is a huge part of my job to make sure that the voices of cancer patients are elevated and heard by lawmakers across our entire state. And cancer patients like you can have a huge impact in the fight against cancer. And your sinker is your ask, and whatever your ask might be, it might be like, can I get your business card so I can follow up with you? It might be, if you want to join me in this work. It might be, would you want to testify? Like, it's just a really great way to kind of help shape and frame your ask to get your point across. And I know it can be so helpful for folks to kind of have like a script drafted out of sorts when you approach your work and the things that you're doing. And I think this a lot of times can kind of like calm a little bit of those nerves, and you feel a little bit more prepared. And so if the hook, line, and sinker is not tickling your fancy, something that is making sense for you or clicking any buttons, think of another way that you would frame it. So I always think of like, you get on an elevator in the first floor and you have to the fourth floor, and you are maybe not in like the fastest elevator in the entire world, but you're also like, it's not going super slow. And you are in the elevator with one person, and you want to get your point across from the time you have on the first floor to when you are exiting the fourth floor elevator. And so if hook, line, and sinker is not something that is helping you envision something, just know like, how are you going to explain yourself? How are you going to give them the information they need of like why they also should be vested in this interest? And how do you end it in a way that's like requiring them to answer a question? Even better yet, when you can kind of frame it so that there's open-ended questions and not just yes or no questions. And so I have a couple examples on the next slide that we'll walk through before we take a couple minutes to, I challenge you all to write your own. So for my examples, I kind of have twofold. One would be like if I was trying to recruit a volunteer, and one if I was like talking to an organization. And these are both obviously ones that I would be verbalizing. You have a little bit more wiggle room, when you're sending that email out to another organization, where it's the balance of enough information, but not so much that you're going to go unread. But how you can get your point across succinctly and impactfully. So my first one is talking about more of a volunteer recruitment perspective. So bringing like a literal grassroots voice into my work. So I'd say, hi, my name is Britta. I work to fight cancer through public policy and rely on the voices of cancer patients to help illustrate how bills impact real people's lives. Are you interested in learning how you can be a part of our work? I give just enough information where they know that, like, okay, clearly I work for some sort of cancer organization and I work through public policy. I talk about the importance of volunteer and patient voices, and I make the ask. And it's not necessarily a huge commitment thing, but it's a bit of a, are you at least interested in learning more? Like, can I buy you a cup of coffee next week? That sort of thing. And so the second example would be a little bit more of me doing outreach on behalf of ACSCAN to another partner organization to kind of form more of a coalition experience. And so super similar, that'd be, my name's Britta. I'm working to end the sale of flavored tobacco products and help Minnesota stand up to big tobacco. Does your organization have any interest in joining our work? I'd be happy to share more details. Again, it's super simple. It's to the point. It gives enough information to kind of illustrate your point, but you're also not like rambling at somebody for 7 minutes straight when you're just like, oh yeah, like, let me get to my point. Do you have questions? And they might be so inundated with information from your 7-minute ramble, which I'm absolutely guilty of. to actually like know what you're asking and to be able to like provide you with any answer, even if it might not be one that you're looking for, but any answer at all. So we're going to take 5 minutes here to practice drafting up your elevator speech. Think of like, what can you get across in 90 seconds or less? We're going to take 5 minutes. Wow, 12:40 on the dot. You can either put it in the chat. You can just write it on scratch paper. It's totally up to you. But we have on the next slide here, Chris, we have just something, I don't know, some ground rules for you for it. But we'll take just five-ish minutes here. Chris, if we're short on time, have us come back early. But just challenging you to take a couple minutes to think of, go back to that initial policy idea that you brought up at the top of the hour. Like how would you bring somebody into your fold there? So yeah, I'll let you know when you have a couple minutes left.
Thanks, Britta. And just to prepare people, will anybody be sharing out loud or just in the chat?
I think if we have somebody who would like to share out loud when our time is up, that would be wonderful.
Okay, great. Thank you so much. So yes, so don't go away, folks. Be working on these. These are going to be helpful to your work going forward, and we'll have Britta let us know when our time is up. And if anyone needs me to back up on the slides, just go ahead and drop it on the chat.
We'll come back in about 2 minutes. Insert your Jeopardy music in your head now.
I would offer to hum, but it wouldn't be very pretty.
We'll do about 30 seconds to wrap up your thoughts. And so this is really where the Jeopardy music, I think, would come in. Do we have anybody who's feeling a little brave and would want to share their little elevator pitch? Safe space. Everybody's right. There's no wrong answer sort of situation. Heather put hers in the chat, which I'm gonna read out loud, Heather, if that's okay, and pretend to be you. So Heather writes, "Hi, I'm Heather O'Carrick. I'm a nurse and living and working in St. Paul Ramsey County. We're working on a program design that will make public health professionals available in accessible public spaces such as libraries, community centers, and other locations. Would you be interested in discussing how our organizations can make this program meet the needs of our underserved community?" I love that. That was perfect, Heather. That was so succinct. That was so to the point. It like painted the picture of the idea, right? Like that is the work that you're working on, and you made a nice ask that's not intimidating, it's not scary, but it's just a little like, let's talk. Let's kind of figure this out together and work together to find something. I love that. And I'll do Ben's as well before we move on, but I'm sure everybody's else is absolutely wonderful as well. So Ben writes, "My name is Ben Cahill. I'm a community health worker and I assist people in navigating housing every day. There's a huge shortage in affordable low-income housing that makes it so difficult for people to get housing. They often just give up. Did you know that landlords are able to discriminate against those with rent payments coming from low-income programs like Section 8, despite them being able to reliably pay their rent? Would you be willing to support change on this by talking to your local city and county representatives about this issue?" Again, perfect, lovely. Again, you did such a great job, Ben, painting the picture of what your issue is and kind of making the ask to bring people into the fold and also feel empowered and a part of this work. That's perfect. Thank you for both of you for being, I mean, I didn't necessarily ask to be able to read your things, but I appreciate your hopeful willingness to let me highlight you there. And I think that goes, we're gonna kind of like close up here. Just talking about like the everyday Minnesotans role in health policy. And so when it comes to passing policy, I'm gonna talk from my perspective of somebody who works to pass statewide policy in particular. Everyday Minnesotans, and I use everyday because we're all everyday Minnesotans, but I'm thinking of like, you know, those run-of-the-mill people who, you know, aren't people like us who work in public health, who might not have like that professional vested interest or that work experience to kind of like sit on our shoulders. But I think of the everyday Minnesotan as, you know, like my volunteer Sharon, who lives in southern Minnesota, who's retired from working at the one of the factories in her local community. I'm thinking of my volunteer who's like a nursing professor at the University of Minnesota, who doesn't necessarily have the policy priority experience, but has that lived experience of being a nurse. Or I'm thinking of Patty up north, who's a retired hospice care chaplain. You know, these people who have this lived experience that it connects them to this work, but they don't necessarily have a job like mine that brings them to the state capitol. And so, yes, there's absolutely the lawmakers who help pass the bills. There are the staff who helps write the bills. There's the lobbyist who talks about the issues, but everyday perspectives of people matter too. We talked at the beginning about the importance and the value of people being able to illustrate the impact policy and the real life impact the policies can have on people. That's going to do more than any lobbyist can ever do. And especially when we're thinking about these big health equity issues that impact so many different people. And we might not be a member of like, you know, the real target population of the solution, but that doesn't mean we can't care about the issue. And that doesn't mean we still can't use our voices to talk about the issues. It still doesn't mean we can't take action and support the work, because especially when we're talking about things like health equity, you know, we're not going to get there unless everybody is behind it and everybody's using their voice and everybody's lifting up the voices of real life impact to kind of get to that rainbow, the pot of gold at the end of the rainbow here. Like, for example, you know, there was all the work this past session around breakfast and lunch being served to Minnesota kids across the state through their school. I don't have a kid, but I still care about the issue. You know, I don't have to have like a vested interest as a parent to care about an issue, or I don't have to be you know, an American Indian woman who gets services from ACAF in the Screen Our Circle program to care about the impact of the Screen Our Circle program. But that doesn't always mean that I need to be the face of talking about those issues, but I can be always lifting others up and taking action. And so I challenge you all just to consider all the ways that you as individuals can make your voices heard, outside of maybe your capacity in your day job or your volunteer job or whatever it is that brings you here. But on the next slide, there's just a couple of recommendations of how you as an individual can help really champion these issues for health equity. You can always join an email list. You can find a mission that inspires you and invite your friends to join you. And many organizations that are working on really, really giant, impressive issues would be super appreciative of your time, your energy and skills and your talent to push these issues forward. And there's always Day at the Capitol events for issues across the Absolute Board that if you haven't been to a Day at the Capitol event, they're super fun, they're super enjoyable, and they're super inspirational. And the host organization often gives you all of the tools that you need to make sure that you have a really fun, exciting, and impactful day. But I hope that this is helpful, and I know this is just the first of a trio of series that are going to be talking about health equity and how we can all be using our voice to really push for policies that will make our world a lot more equitable when it comes to our disparities we see in health. But I hope this kind of helps you think of the recruitment and capacity building things, and how you can bring more people into your work that you're doing. I'm happy to answer any questions that you might have, but Chris, I'll toss it over to you.
Yeah. Well, first of all, thank you so much. This is absolutely amazing, Britta. You did such a great job and really gave us some really practical tips that we can walk away with. So appreciate it. And it was very engaging. Go ahead and drop your questions in the chat or come off mute and let us know what they are. There are a couple that came across privately that I'm happy to read out loud, but I want to give everyone else a chance to ask their questions. So I'll give it a second just to see if anyone wants to pop off mute. Count to 10. All right. While I wait for other people to ask their questions in the chat, want to just read this question out. So I've never talked to my legislator before, and I'm nervous to approach them. Do you have any tips on how to make that easier?
Absolutely. That's a great question. It is a super common concern, but I promise lawmakers put our pants on just the same that we do. They are not fancy, scary people. They might have really fancy titles that seem a little intimidating. But one thing, so I think almost the same thing that we use like the hook, line, and sinker when it comes to our little elevator pitches, that is exactly how you can use to reach out to a lawmaker. So if you're somebody who's like, you know what, I'm not gonna make a phone call, but like I'm gonna send them an email, you can still use that same exact hook, line, and sinker method to talk about whatever it is you want to talk to your lawmaker about. And so, you know, I would write, "Hi, Representative Hassan. My name's Britta Babel. I'm a resident of yours living in Powderhorn Park in Minneapolis. If I was talking about one of my cancer issues, you know, I might say like, when I was little, I lost my mom to cancer. And so fighting back against cancer is really important to me. I'm advocating for a bill this year that would remove barriers to biomarker testing for more Minnesotans. I'd be happy to get you more information on it, but do you think this is something that you'd be able to support?" You know, when it comes to a constituent, that everyday Minnesotan maybe, reaching out to a lawmaker, there's no expectation of you being a policy expert. The likelihood of you sending them about something that they've never heard of or don't know who they might ask for is pretty slim. I always say lawmakers have the knowledge, it's a mile wide, but only an inch deep. They're probably not going to be a subject expert on whatever it is that you're reaching out to them on, but they might have an idea of who they can connect with, especially if you're reaching out on a policy that's like being talked about, it's introduced. You just need to let them know that you're sending it.
Great. Very helpful. Thank you so much. Just comment about what an informative, enlightening presentation. So thanks so much for the great information, encouragement. Another question is, is there anything that we should be aware of given the policy priorities that were mentioned? Anything that you know of, coming up in next session or that legislators are talking about?
That is a great question. I know there is a lot of work being done around community health workers in multiple different public health circles. I know there was like some big grant work this past legislative session. Session did just end like May 22nd. So, and won't begin again here in Minnesota until like February 12th or something like that. I'm not quite ready to think about February personally, but I will say that we have our current legislature, I think, is pretty hungry for policy change when it comes to our healthcare in particular. And so I would not be surprised if we kind of see another, maybe not as large scale session as we just finished up here in Minnesota. But we do definitely have, I think, a ambitious group of legislatures who do want to make some like pretty ambitious change.
Okay, great. And then last question, and I'm gonna stop sharing and turn it over to Mary, our executive director, and after this question. But any like either like best stories or worst stories that you want to share with your experiences of engaging lawmakers?
Yeah. So I have one as far as like a worst story goes from when I was actually a volunteer for ACSCAN, and I was meeting with a lawmaker. It was a day at the Capitol event, and I was a college student. I was at the University of Minnesota, still getting my undergrad degree then. And I was not a constituent of the person, but I was paired with somebody else, and we were in a lawmaker's office. And it was me, so I was like probably 20 years old, and then I was paired with probably like a 60-year-old man from southern Minnesota. And so we on two totally different sides of the spectrum, just like quite the pair walking into a lawmaker meeting. And I had a lawmaker that was he was so rude to me. He did like the classic like lean back in my chair, put my feet up on the table while you're talking to me type thing. And I don't say this to like dissuade you, but I say it because it was really empowering for me actually, because I tapped into the training that I got the day of and was able to come back at him. And I was like, no, I'm not here for you to go on a rant about something that we're not here to talk about. I'm here to talk about these cancer issues and how it impacts me and my neighbors and my community. And it was one of those scenarios where like it could have gone so poorly, but I was able to be like, no, like I'm here. I am a Minnesotan. You are an elected official. I'm your boss. Like, you got to talk to me and you have to respect me. And I think use that as like some of my fighting energy still, like almost 10 years later when I'm approaching some lawmakers. But I will say that there is, as far as good, it is so powerful to see somebody who's maybe never had a lawmaker meeting before leave that first lawmaker meeting they have, and they kind of like have like a natural high of just like, oh my gosh, I just did that. Like I just made that happen. Like the first time they might tell their story, and maybe they're a little nervous because these stories are so deeply personal, what brings us to this work. And so it might feel like they might be really nervous. They might be feeling super vulnerable, but when they're able to kind of see it click and see their real life impact and how their story can make such a big difference, it is like an absolutely priceless feeling for me.
That is so perfect. Love that. Mary, I'll turn it over to you. Be watching everybody for a link to an evaluation.
Thank you, Chris, and thank you, Britta, for an outstanding presentation. I hope everyone found this valuable today. This is part of MPHA's racial health equity work, which is generously funded by Blue Cross Blue Shield of Minnesota this year. So I'd like to acknowledge that, and also wanted to ask you to please stay connected. So there's a lot of information on the slide. We will send it out, but go to our website, mpha.net. You will see we've got still 3 more great events this week, including a very special health equity committee meeting another event about community health workers, and we have our MPHA annual business meeting and awards ceremony tomorrow, which is open to everyone. We've got a couple of more great events coming up later this month, so be sure to check those out, and we hope you can join us. Thank you so much, and we look forward to hearing how you put your work into action.
Thank you all. Have a great day.
Thank you.